I am Dr. Shubhra. I am an eye and face plastic surgeon. Welcome to Mannghatt. Let's talk about eye bags. What are eye bags? Now these are the swellings or the pooches which are seen below our eyelids or on this part of our face, and pretty common. I would say as common as the white hair on our head, and all of us are eventually going to get it. At what age do we get it depends on multiple factors. Let's get to that little later. Usually people who have it would actually present with a lot of different kinds of complaints. Some of them feel that they're looking tired. Some of them feel that people complain that they haven't slept for hours together. Some of them actually come with a complaint that, they have been wearing glasses for very long hours and that's why they have got it. Well, some of them are right, some of them are not so right. And it's okay because these are complex issues. Let's kind of divide these two into two types. One is what you see, the bulge below your eyelid, which is nothing but the fat. This fat is usually supposed to be behind our eyes, but because of certain factors, because the tissues which is responsible to hold them backwards become loose and they come out. And the other one is the water collection here. You must have seen a lot of people having, water collection here. And again, that's a water collection because of tissues which cannot hold them. Yes, it is an aging process, no doubt about it. And as I said, we all are going to get it sooner or later. And if you look closely, maybe I have, started to get part of it. But apart from that, there are two other factors which lead to it. They are also the telltale signs of what is happening to our body medically inside. Now, when I say medically, means diseases like diabetes, hypertension, your kidney is not working properly, or maybe you have thyroid, because all these diseases cause low water retention in our body. And the more the water retention is in the body, the tissues are going to become sponge-like and they kind of give way, and that's where the fat and water gets collected. In addition to that, again, your lifestyle. Now, how does lifestyle cause it? One may ask me. If you are an alcoholic, if you smoke, if you're taking a lot of fast food, if you're having a lot of sugar, and so on and so forth, let's put them in one bracket. They're all the poisons, the addictive poisons for our body because they produce free radicals. Now, free radicals cause an oxidative damage. What is oxidative damage? Is something, and a molecule which comes and tells your tissues that you have lived enough. Let's kind of age, so that's called an oxidative damage. So that's where it gets fastened or it gets speeded up. So you must have seen in some individuals as early as 20 or 30 years old, you can see these changes. Whereas in somebody, you may not even seen it at the age of 60 because probably they have been in a very disciplined lifestyle and they don't have any of these diseases. And plus, nature has been kind on them because their aging process is kind of slowed down, delayed because of their DNA makeup. So these are the reasons why we get the eye bags or the water collection below our eyelids. Do we need to correct them? Of course, because they are cosmetic blemishes, and in addition, they can cause difficulty in wearing glasses, they can cause sweat collection, they can cause a lot of irritation and what we call as dermatitis, and there are ways to correct it. And as I always say, when the client comes to me, I have a conversation, get into the detail of what they are having, what they're doing to themselves, and give them the treatment options like lasers, injectables, surgeries called blepharoplasty or facelift, and so on and so forth. Another point I want to bring here, which people often miss out, is the lymphatic blockages. Lymphatic blockage is a scientific terminology, but it is absolutely holistic in nature. What I mean by that, if you take too much of stress, if you internalize, if you don't exercise enough, we have a lymphatic system in our body which drains the extra fluid out of our body. And again, I can take my example because I had lymphatic blockage and I had to undergo a lot of massages, release exercises to let it off my body. So if somebody has lymphatic blockages, which usually the modern science would not focus on, eyelid bags and festoons or the water collection are very commonly seen even in younger patients. We have to take care of all these things in addition to the treatments which are to be offered. A combination of these two is what I suggest is the best way forwards in treating the eye bags and the water collection. Now, mind you, none of these treatments would work, either fail, would not work to the optimum level, or you may have a recurrence if you don't pay attention to the reason behind it. Leave aside the natural process which causes it, but please focus on things which you can control as an individual. Then the treatment would be, the best what you get for yourself. Treat the eye bags in a very holistic manner. Look at yourself. get your diseases in order, eat, drink and sleep well. Please don't have an addictive lifestyle. Reach out to your physician for best of the treatments. So if you like this video and it resonates with your thoughts, do subscribe, like and share to Mannghatt.